Hello everyone and welcome to our webinar, Moving Against Cancer, Working with Local Coalitions. This webinar is being hosted by the Asian and Pacific Islander American Health Forum and the Asian and Pacific Islander National Cancer Survivors Network. My name is Trish Gema and I am with the Chronic Diseases team here at the Health Forum, and I am also joined by my colleague Pedro Arista, who is also with the Health Forum. And before we begin, I want to briefly cover some instructions on how to ask questions through GoToWebinar. On your screen, you should be able to see the control panel on the right side of your desktop. And after approximately 10 seconds or so, the control panel automatically collapses to the right side of your screen with only the Grab tab displayed. You can use the double arrows at the very top to open and close the control panel. You can use the question pane, the one highlighted in red, to ask us and the presenters any questions that you may have. We encourage you to ask questions, and we will be collecting your questions throughout the presentation, and we will have time at the end for Q&A. Finally, we will be recording this webinar, and this will be uploaded onto our YouTube page, www.youtube.com/APIHF, and I'll show this information at the end too. But for those of you who would like PDF copies of today's presentation, please let us know by typing in your email address on the questions pane to your right. So that's all I have for housekeeping items. Again, this webinar is being hosted by the Asian and Pacific Islander American Health Forum and the Asian and Pacific Islander National Cancer Survivors Network. We are a 25-year-old organization which influences policy and strengthens organizations and their communities in order to mobilize Asian Americans, Native Hawaiians, and Pacific Islanders to advocate for their health and well-being. We are headquartered in San Francisco, California, and we also have a Washington, D.C. policy office, and we also have relationships with many community-based organizations from around the nation. So our mission is to influence policy, mobilize communities, and strengthen organizations and programs to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. The Asian and Pacific Islander National Cancer Survivors Network is a network of cancer survivors, their family members, healthcare providers, researchers, health advocates, community members, and organizations who are concerned about the issue of cancer and survivorship in the Asian American, Native Hawaiian, and Pacific Islander communities. The role of the network is to support and build capacity in cancer control, which includes prevention, education, screening, treatment, and survivorship, cancer control systems, and to be engaged in the larger Asian American and Native Hawaiian Pacific Islander health movement and policy agenda. We currently have 560 members nationwide, and we would like, of course, to encourage all of you to join our network if you're not yet a member by visiting the URL below that you can see on your screens on our website, APIHF.org/APINCSN/membership. And you can see, we're one big happy family. This is our National Advisory Council on the screen that you can see. So with that said, APIHF is a current grantee of the Centers for Disease Control and Prevention, and this webinar will present to you strategies and the value of working with underserved and emerging AA and NHPI populations. This webinar will provide unique and valuable information on how you can work with cancer coalitions in your community. And I'm very proud to introduce our webinar presenters today. First is Pedro Arista, who is our Chronic Diseases Program Manager here at the Health Forum. He was previously the Director of Community Programs at the San Francisco Department of Public Health HIV Research Section. He had also previously been at the University of California, San Francisco for 7 years. Today, he will be sharing information on cancer trends and demographics in Georgia. And next we have Marianne Chung, who is the Associate Director at the Center for Pan-Asian Community Services, CPACS, whose mission is to create and deliver culturally and linguistically competent and comprehensive health and social services for Georgia's Asian Americans. Ms. Chung oversees the day-to-day operations of all departments and programs at CPACS, which serves about 1,800 individuals and families a month. She will be talking about the value of working with local cancer coalitions. Our final speaker is Angie Patterson, the Director of Patient Navigation and Survivorship Programs at the Georgia Cancer Coalition, an initiative of Georgia Research Alliance. Ms. Patterson has been a member of Georgia's Comprehensive Cancer Control Plan steering team since April 2006. She also serves on the steering team for the Georgia PAIN Initiative and the Stop Childhood Cancer Alliance. She is also the co-founder of the Cancer Patient Navigators of Georgia organization. Her leadership at the Georgia Cancer Coalition has the ultimate goal of making Georgia one of the nation's premier states for cancer care, and she will be sharing more about their coalition's initiatives today. So we are very, very fortunate to have our speakers join us today and lead us through this information session. With that said, we would like to begin this presentation. Pedro, you may begin at any time.
Thank you, Trish, and thank you to everyone for attending this webinar. As Trish mentioned, I'll provide some information about cancer trends and what they look like in Georgia, but also provide a bird's eye view of cancer trends, what they look like in terms of in the country, and also specifically to Asian Americans, Native Hawaiian Pacific Islanders. Next slide. So as we can see clearly from the U.S. Census data from 2000 and 2010, Asian Americans increased significantly, about 46%. Also with NHPIs, we can see an increase from 2000 to 2010 of 40%. Again, that we can see that both these groups are emerging populations in the United States, which is really, which is why it's really important for us to sort of build our understanding of what is occurring in these groups as it relates to cancer, as well as other health disparity issues. AA and NHPIs in the U.S. are extremely, extremely diverse. I think one of the take-home messages from our discussion today is really that it is a very, very diverse group. There are about 30 distinct Asian ethnic and cultural groups. About 60% of Asians in the U.S. Were foreign-born in 2009. So again, as we can see, though that has implications as well for building our understanding of immigration issues, whatnot. Also, we can see approximately 50 distinct NHPI ethnic and cultural groups. 12% of NHPIs in the U.S. are foreign-born in 2009. Again, something for us to consider around immigration and access. There are more than 2,000 distinct Asian and Pacific Islander, Pacific languages and dialects. And there are more than 100 Asian or Pacific Island languages, dialects commonly spoken in the U.S. Again, this is highlighting the beauty and diversity in these groups within AA and NHPI. Now we're going to move into cancer incidence, looking at new cases and rates. We focus on Asian Pacific Islander. We can see in men between 2003 and 2007, we can see the rate at 330.4. Compared to women, API women, we can see the rate at 276.5. Now, if we look at mortality, we can see that API men are at 134.2. Again, the rate is per 100,000. And we can see that 94.1 API women, Again, the rate is per 100,000, looking at mortality rates. Well, what the question remains then, what is the impact of cancer on AA and NHPIs? Well, compared to whites, Caucasians, AA and NHPI men are twice as likely to have stomach cancer. Again, this is highlighting the disparity. AA and NHPI women are almost 3 times as likely to have stomach cancer. More interestingly, AA and NHPI men are about 40% less likely to have prostate cancer compared to white men. However, prostate cancer is a top cancer for AA and NHPI men, again, highlighting a disparity and encouraging us to really build our understanding of what is going on as it relates to prostate cancer in this group. And continuing on, AA and NHPI women are 30% less likely to have breast cancer as compared to white women, but breast cancer is still the top cancer for AA and NHPI women. The next chart is actually is one of my favorites, I have to say, because it really highlights for me the value of having disaggregated data. It really presents a clearer picture, a clear understanding of what is going on in the different subgroups of AA and NHPI. For example, we can clearly see the number of new incidents in race among Korean men in liver cancer. Korean men are almost at 36, at a rate of 36. And that's not the case with Asian Indian and Pakistani, which is at a rate of 8.7. That clearly is building our understanding of what liver cancer looks like in these subgroups. Additionally, we can move forward and see that Korean men and women suffer stomach cancer greatly compared to other subgroups. And we can see thyroid among Filipina women is nearly 18, at a rate of 18, followed by Vietnamese women at 13.3. And Vietnamese women are suffering the highest of cervix cancer at a rate of nearly 17. Now that was sort of a bird's eye view of what is happening nationally. Now we're going to sort of focus a little bit more on Georgia and what's happening in terms on the ground, but also what it looks like in terms of AA and NHPI communities. In 2006, 2.75 of the Georgia population were Asian or Pacific Islander. And interestingly, in Gwinnett County, which includes Beaufort and Duluth, that county had the highest Asian population at nearly 70,000, followed by Fulton County that had over 40,000 Asians. Richmond County had the largest NHPI population at little over 1,000. What you can see, the chart to your right clearly indicates that African Americans are a leading group in people of color in the state of Georgia. And now we're going to look at Georgia's Asian alone population, so non-NHPI, just Asians alone. In Georgia, as of 2006, the population was almost 255,000 Asians in 2006. That was a significant increase of almost 50% increase from the 2000 census. The top 4 groups that you see on the right are Asian Indian at almost 75,000, Korean at almost 46,000, Vietnamese at almost 45,000, and Chinese, with the exception of Taiwanese, a little over 35,000. I also think it's important to note the percent changes next to these 4 groups, again highlighting that these groups, as well as other AA and NHPI groups in Georgia, are emerging populations. So something for us to consider and food for thought as we look at the next census, census data coming along in the near future. Also, what's remarkable from this chart which highlights is the Indonesian population, the growth from 2000 to the current 2006. There was a significant increase in Indonesians, a 243.7% increase from 2000. Now we're going to look at Georgia's NHPI population. Two of the larger groups of NHPIs in Georgia include Native Hawaiians at a little over 1,500 and Guamanian or Chamorro at 1,667. These two groups are the larger NHPI groups in Georgia. What's also important to note is the percent change that happened from 2000 to 2006 among Native Hawaiians significantly. It's at almost 80%. So again, an emerging group that we need to look at. Now we're going to look at cancer incident rates among women in Georgia. This is, again, it's a general population Georgia primary sites. We can see the 10 are listed here. The top 3 include breast, lung, and colorectal. When you look at the data more specifically, more closely among AA and NHPI females, you can see breast cancer has a rate of 73.6, colorectal at 25.5, and thyroid at 15.8. So clearly there is a value to looking at data more closely among ethnic groups. We can see a clear marker, clear difference here. Cancer death rates, the top 10 for Georgia women are listed. The top 3 include lung and bronchus, breast, and colorectal. And if you, we attempted to look at AA and NHPI females, however, there isn't data available. It's hard to draw conclusions from a very, very small sample, so we weren't able to get data for that. Now we're going to look at male cancer incident rates. The top 10 are listed here. The top 3 include prostate, lung, and colorectal. Among AA and NHPI males, we can see prostate is at over 75. Lung is at a rate of almost 30, and colorectal is at 25.5. If you look at both this and the overall population in Georgia among men, it's similar in terms of prostate, lung, and colorectal. Rates are different, of course, but the top 3 cancers are similar. Cancer death rates for males in Georgia, the top 10 are listed. The top 3 include lung, prostate, and colorectal. Among AA and NHPI, the leading cancer killer is lung and bronchus at over 20, at a rate of over 20. Something for us to really look at and consider as we increase messaging, intervention, screening, etc. So some key summary key points that I'd like to sort of move with and really highlight here is in order for us to really have a critical understanding of what is going on among AA and NHPI, we really must have this aggregated data so we can build our understanding of what is going on in terms of different subgroups. As we mentioned as we're starting this discussion, AA and NHPI groups are so highly diverse, so it's really important for us to really have a clear sense of what cancer trends look like in each of these subgroups, especially because we're an emerging population, emerging groups. And also, as we move towards policy decision making, that is often based on aggregate rates, aggregated data only, and that really does not serve us justice. It actually increases health inequities. So it's really, really important for us to really have, again, a sense of what is happening on the ground. What does cancer look like in Filipinas, Chamorros, Native Hawaiians, Koreans, etc. But something can be done. And as Marianne will highlight and Angie will talk about as well, successful outreach, implementing a successful outreach strategy locally, nationally, can be very, very effective. Also, making sure that research activities really address the needs of the community. And also making sure that when there is opportunity to really address AA and NHPI cancer health inequities. What we must do is begin, and we need to start and end with communities. Communities AA and NHPI communities must be at the table. They must be provided a space at the table to not only design interventions or design survivorship groups, but also research questions. We must address language access. As we mentioned, it is a highly diverse community, a wealth of communities, so it's really important that we address these language access issues. We must be culturally competent and culturally compassionate. We must engage in partnerships and collaborations as what Marianne and Angie will talk about, the value of partnerships. We must include CBPR, community-based participatory research, where the researcher is really committed to working with communities from beginning, implementation, to results and dissemination. And lastly, we must be responsive and accountable to all the AA and NHPI communities that we serve. So with that, I'd like to thank you, and I would like to now introduce Marianne, who is going to talk about the wonderful work she's doing on the ground at Georgia. Thank you.
Thank you, Pedro. When we think of Asian Americans, I do not think that many of you will immediately think of the American South or Atlanta, Georgia. However, the population trends continue to show emerging communities with significant Asian American growth. I know that many of our native Hawaiian and Pacific Islander brothers and sisters are on the line today, and I want to acknowledge their presence, as Pedro had mentioned the numbers in Georgia, but note the limitations for me today is that I will discuss only about our work with Asian Americans. And Pedro had shared, some very important data of Asian Americans in the South and in Georgia. But did you know that in 1990 to 2000, the Asian Pacific Islander population doubled in the state? And then again, in 2000 to 2010, the population for Asian Americans and Pacific Islanders doubled again. So for every 10 years, our population is doubling. And right now within the state, according to the 2010 census data, there was about 300,000 Asian American Pacific Islanders in the state, and almost 80% of those were living in Metro Atlanta. For the Southeast region, for Asian Americans, right now there's about 1.5 million according to the last census data. Earliest records show that Asian Americans, and specifically Filipinos, have been in Georgia since the early 1700s. The Filipinos were documented to help build the canals in Savannah, Georgia. But unlike many states with long histories of Asian American resettlement, the signs of our growth has been recent, and the population makeup is different from the larger established communities. So in Atlanta, about 9 in 10 of our Asian American communities are foreign-born. Almost 50% have limited English proficiency, and 1 in 3 in the state are low income. With these significant challenges also comes with systems of care challenges. The systems of care like hospitals, health departments, and other groups serving our communities are also experiencing challenges in catching up to this growth of this community. So it is critical during this time of growth that community-based organizations like mine at CPACS are working in coalition to serve the community. I hope that our lessons learned will help others in both emerging and established Asian American communities in their work with their local coalitions. On the next slide, I will start with the lens of where I come from. So I work at the Center for Pan-Asian Community Services, or CPACS, and our mission is simple. It's to create and deliver culturally and linguistically competent health and social services. We have 10 major departments: health services, counseling, housing, social services, legal services, community education, youth programs, senior services, research, and advocacy work. And we see an average of 2,500 clients this year per month who walk through our doors, make a telephone call, or go through an existing services. And the majority of the clients that we see face significant challenges in accessing health screening and services due to language and cultural barriers. On the next slide is CPACS' theory of change, of how CPACS can promote self-sufficiency and equity among the communities we serve. And as you see, our goals are to empower immigrants and refugees, build stronger communities, and mobilize for social change. And we do this through our three-legged stool model, and that is through direct services, capacity building work, and advocacy. And the key for us in this model of success is working in coalitions to accomplish that work. And what I want you to hear through this discussion today is the strong importance of building strong relationships. Again, relationships, relationships, relationships to working in coalitions. I have 4 key reflections for building strong relationships to work effectively in coalitions. And then I will start with the first one. So on the next slide is really number 1 is finding win-win situations. CPACS has a very successful Asian breast care program that links over 550 women to affordable mammograms and clinical breast exams annually. Last year of the women served, only 7% had health insurance, and 63% of those women never had or had a mammogram over 2 years ago. And practically all the women who went through our program had limited English proficiency. When we began the program in the late 1990s, just referring a woman with vouchers to services was not enough. They simply would not go. And so we started partnering with local mobile mammography service units. And this was a win-win situation for the hospital mobile units because they were able to serve Asian Americans in their county, and for our community because we were able to better serve these populations. Today our navigation program begins from outreach and to follow-up care, all in language. These collaboration with the local hospitals, as you can see on the screen 3, has allowed thousands to be screened who otherwise would not have had access. And it is very interesting that each month we have at least one woman who is coming from North Carolina, South Carolina, Florida, or Alabama for these services because they are culturally and linguistically competent. On the next slide is my second key lesson learned in the power, and it is the power of mentorship that comes from relationship building. In 2007, CPACS was part of a technical assistance program through the Asian Pacific Islander American Health Forum and their AAPI Cancer Support Group Mentorship Program. We always felt that there was a huge gap for women in our programs after diagnosis. While cancer support groups existed in the city, we needed cancer support groups that were in language. The Technical Assistance Program was the perfect opportunity, and the Asian Pacific Islander American Health Forum connected us to the Wellness Center in Pasadena, California, and a woman named Jane, who had been running Korean cancer support groups for many years. She helped us start our in-language cancer support group program and give us valuable feedback and advice throughout the whole process. This mentorship opportunity allowed CPACS to create a strong Korean in-language cancer support group that is a sacred space for women to share their journeys of survivorship. Right now we have an average of 15 women who come religiously every other week for these cancer support group services. Without this support and other partners, this would not have been possible. On the next slide, I think of the phrase, we must give back for what we have received. And in 2009, we began a Chinese in-language cancer support group with the mentorship of the Korean cancer support group leaders. Right now, this program is very strong as well, and we have an average of 10 women who attend each session. Right now, these 2 programs remain the only 2 in-language cancer support groups in the state and in the Southeast for Korean and Chinese women. And this would not have been possible without our collaborations and our partnerships. The next slide, what I hope you have been hearing from me is that I've been giving you a lot of data about our community and about our successes and also about our challenges. And so this is my key, third key takeaway. It's about working with coalitions, and it's that I have to know my data and I have to know my community. For me to be an active member of any coalition and for me to speak well on the issues, I must know the community and their needs and to understand what I can bring to the table that will benefit not only my community and my organization, but the larger community. This is the only way that I'm able to advocate and get buy-in for these emerging Asian American communities. And also knowing that the best practices that are happening within my community will also benefit the larger community in our fight to address cancer. The 2 photos are photos of our recent success. And so the photo on the left is a textbook that was published in 2009, Asian American Communities in Health. And our Asian Breast Care Program was highlighted in that textbook. The picture on the right is a YouTube image. And if you go online to YouTube and you type in that link, you will see a documentary of our Korean in-language cancer support group. And finally, the next slide, what I have learned is to be innovative, to meet communities' needs. I've learned that to serve emerging Asian American community needs and ensure that they have pure wraparound services, we must be innovative to meet the community. There are a lot of best practices in our mainstream communities. However, we also know that the one size does not fit all. But I must understand, and I must know, and I must be keep on learning about the key elements of these best practices so that I can better integrate to better serve the Asian American communities in the state. And so the next slide, I want to share a story. On the next slide, you will see our cancer support group women. When we started the program, we heard so many times these women, when they would come to the program, and says, "I was so alone. I had no one to talk to, and I was so scared." And when they came to the Korean Cancer Support Group, they found other women like them, other sisters within the Korean community, Korean American community, who shared their journey and who shared their struggles. And these are photos of every year from the very beginning of the cancer support groups. We took our women to the Coleman Race for the Cure races. And every year there's at least one woman who has tears in her eyes as she's passing the finish line, because she has come to the realization that she is not alone and that she is connected to a larger network of strong and powerful survivors who are contributing and giving back to their community. And so now these members of the Korean Cancer Support Group have found ways that they can give back to their community. And similarly, I think this is true for coalitions. You know, oftentimes we feel that we are alone, and what are we to do, right? We are scared, and we have no one to talk to about our challenges within our communities. But by working with others, the battle is not so lonely, and that there's more power and there's more impact when we come together. And so coalitions and partnerships all revolve around, to me, relationships. Again, it's the relationships that we build and the interconnectedness that we have to the larger movement. One of the most successful partnerships that I can think of now that we have is with the Georgia Cancer Coalition. And so I want to thank you for this opportunity, and I want to hand it over to Angie of the Georgia Cancer Coalition to share the work that they are doing. Thank you.
Well, thank you so much, Marianne. And this is Angie Patterson. I'm going to kind of give you some overviews of Georgia's statewide cancer initiatives, and which provide opportunities for organizations to get involved in from around the state. So briefly, I'll give you a quick summary or history of the Georgia Cancer Coalition. We were created in 2001, and we were established as a separate nonprofit, receiving small portions of funding from the state, from the tobacco settlement funds. And our mission was to unite government agencies, hospitals, academic institutions, survivor organizations like CPACS, other organizations to unite together and reduce the number of cancer deaths in Georgia. Last year, due to funding issues, we were merged into the Georgia Research Alliance. So you'll see that in my introduction, I was listed as the Director of Patient Navigation and Survivorship for Georgia Cancer Coalition, which is now an initiative of the Georgia Research Alliance. So with the next slide, I'm going to begin talking a little bit about Georgia's Comprehensive Cancer Control Plan. And you can go to the next slide as well. For those of you on the call, hopefully most of you are familiar with this program. It is a CDC-funded program to really help enforce collaborative process through which a community and its partners pool resources to reduce the burden of cancer. And as of last year, the CDC is supporting programs in 50 states, the District of Columbia, 7 tribes and tribal organizations, and 7 U.S. associated Pacific Island territories. And in Georgia, the very first Comprehensive Cancer Control Plan was actually the strategic plan that the Georgia Cancer Coalition created with our establishment in 2001. But then that was developed in 2001, and so in 2006, the CDC recommends that you revise your Comprehensive Cancer Control Plan every 5 years. And so the Georgia Cancer Coalition partnered with the Division of Public Health to co-lead those revision efforts, and we hired the Georgia Health Policy Center to help facilitate this effort. We also brought together a very diverse steering team. And as Marianne mentioned, one of the successes around cancer control is bringing together diverse organizations. Our steering team included organizations such as the Georgia Cancer Coalition, the Georgia Hospital Association, nonprofit organizations in Georgia, Cancer Survivor Leadership Council of Georgia, and various other organizations. We wanted to be all inclusive. Now, those of you in other states, you may have heard of state coalitions, and in a lot of states, the state coalitions are really kind of a virtual organization. It's different groups brought together really just to focus on comprehensive cancer control planning, whereas the Georgia Cancer Coalition is a little unique in that we do co-lead that effort, but we have other statewide initiatives, which I'll share with you. Next slide, please. So as I mentioned, we began the revision process, and in 2007, after working on it for 1.5 years, we had revised our comprehensive cancer control plan. And throughout that process, we had over 150 participants from around Georgia helping us revise the plan. We wanted a state cancer plan that reflected all populations, all parts of Georgia. And Georgia is a very diverse state. We have rural areas. We have the savanna on the ocean, we have mountains, we have farms, we have everything. And so we wanted to make sure we were very inclusive in revising our comprehensive cancer control plan. And the Georgia Cancer Coalition had commissioned the Institute of Medicine to come into the state and develop a report for us and help us identify what we really need to be focusing on. As Marianne mentioned, it's important, and as Pedro mentioned, to have the data and to understand what is the data behind what you're doing and what is the evidence and the metrics that you're measuring to do this. This report had 52 measures across a continuum of care for cancer. So as we developed our plan, we wanted to make sure that we also addressed cross-cutting issues, eliminating disparities, and that's a top issue, increasing access, and also focusing on survivorship. So after the work that we completed the revision, we released the plan in 2008 at a statewide conference to share with the all the participants and other healthcare professionals in the state that were very interested in our cancer plan. Once the plan was revised, we began the implementation planning phase and then the implementation phase. And in October of 2010, we brought everyone back together to say, okay, this is where we are in implementation. Who is at the table? Who are we missing? What do we need to focus on? And in that meeting, we realized that survivorship and palliation really needed to be more of a working group than a cross-cutting issue. It was very important to be focusing on survivorship and palliation. And at that time, we began reaching out to other organizations to get involved in the survivorship component. And we're very, very proud to have Marianne as one of our key leaders in the survivorship working group for a comprehensive cancer control plan. Next slide, please. Coming into this year, our current cancer control plan was from 2008 to 2012, so we're in the process of revising the plan that we had and to really make it pertinent, to make sure that we're focusing on what are the top priorities right now in the state of Georgia. And as you can see on your screen, these are the working groups that we now have. We have a prevention, education, early detection and screening. We've combined diagnosis, staging, and treatment into one working group, and then we have the palliative care and survivorship. And one thing I wanted to highlight here, the key goal that we're focused on in the survivorship working group is looking at treatment summary and survivorship care plans. And this is something that is very, very important for all organizations and all survivors in the state. This is a new Commission on Cancer guideline that states every cancer patient should receive a treatment summary and a survivorship care plan. And so our working group is really focusing on how do we make sure that patients understand that, how do we give the tools to the hospitals in Georgia to ensure that they receive those. And then we have data and metrics as an overarching group looking at what are the evidence behind what our goals are being set for. The next statewide initiative I want to share with you, and again, these are efforts, these are initiatives where organizations such as yours can become very involved in. We have created an organization called the Cancer Patient Navigators of Georgia, and a little over 4 years ago we had an opportunity to have Dr. Harold Freeman come down to Georgia and talk about his lay patient navigation effort that he developed in Harlem. And we realized at that time we had over 120 people attend that. But that is a really key component of us focusing on patient navigation in Georgia. And we selected the definition that C-Change uses. What is cancer patient navigation? It's individualized assistance offered to patients, families, and caregivers to overcome healthcare system barriers and facilitate timely access to quality medical and psychosocial care from pre-diagnosis through all phases of care continuum. And so based on what we were seeing with the interest of patient navigation, we created this organization to include all navigators, not just nurse navigators, but lay navigators. And in some communities, these lay navigators really are also the same thing as community health workers. We have a great statewide program of community health workers that are more focused on other diseases besides cancer, but those community health workers are also members of our cancer patient navigators. So this is another type of coalition, as Mary Ann talked about, bringing organizations together to share best practices, to help each other, educate each other how to improve quality of care for their patients. Our mission is to connect, educate, and share best practices among patient navigators in Georgia so that together we can successfully reduce barriers and increase access to services specifically related to cancer. And within this organization, we have 254 members right now. We have several from the CPACS organization. There's another organization in Georgia, Boat People SOS. We have representatives from that. So a lot of people are actually doing navigation. If you're helping eliminate barriers for your patients and for their family and caregivers, you're helping them navigate through their cancer journey. This organization is, up until this past year, was free for you to join. And every year we host an annual meeting. Right now, the membership fee is $10, which is not too expensive, and it does provide a one-day training every year to bring everyone together and educate you about what's going on in the state. Next slide, please. As I was mentioning, there are different roles for navigators. And I just put this slide in here to show you an example. For example, like the outreach navigation. This is a perfect opportunity for lay health advisors or navigators. And a lot of you are doing this. As Mary Ann talked about, they're going out and they're educating women about breast cancer, about the importance of screening and early detection. So this may be a function that many of you are already doing. There is a diagnostic navigator that helps alleviate other barriers, and this may be a role for a social worker. Of course, there's treatment navigation, and this would be where a nurse navigator is very, very important. And then once you move into your survivorship, to make sure your stress management, your long-term care plans, then that may be a nurse practitioner. So there's a lot of roles in navigation that people are doing today, and they don't realize that that's what they're doing. There are different terms for it, as I mentioned, community health workers, or there are, health advisors. There's a lot of case management. Next slide, please. Within the organization, we do have a website where we have all of our members' information. We send out newsletters every month or two, or every 2 months, to educate our patients about what's going on in Georgia. And this was an example of when we held our annual meeting to talk about navigation through the continuum of care. That was held last September. We have a meeting coming up this September as well. Next slide. I mentioned our website, and you can find our information. If the URL is on your slide. If you want to click on that, you can see what information is out there for Cancer Patient Navigators of Georgia. And then if you are within our state, that is one thing. If you are navigating patients within the state of Georgia, you can become a member. But we also have resources out there for navigators and other resources that might be of value to you. Next slide, please. This is just really a slide that shows you where our navigators are currently located, what counties they are in Georgia. And so if you want to map back to the data that Pedro was sharing, where your populations are, you will see that we have navigators in most of the areas where those populations, you have high populations that you would like to focus on. Next slide. We do have other statewide resources and initiatives I want to share with you. GeorgiaCancerInfo.org is a new website that has been implemented. Georgia Core, which is the Center for Oncology Research and Education, which is a sister nonprofit organization here in Georgia, they really have focused on clinical trials in Georgia. They've developed this network to connect all of the clinical trials, the physicians who offer clinical trials. So on this website, if you're looking for a breast cancer clinical trial, you can find information on here. We also have other resources on here around patient navigation. We have support groups listed in different parts of the state. So this is a great website that you could, I wanted to share with you. Next slide, please. Georgia is very unique. When we were created in 2001, we also received funding to create regional cancer coalitions of Georgia. And you'll see from this map the different counties those regional cancer coalitions are responsible for. They are separate 501c3 nonprofits. But they really have their finger on the pulse in their community. They know where the screenings are being offered. They know where their populations are, what the disparate populations, what they need to focus on. So within Georgia, as Marianne mentioned, the highest population of the Asian Americans is really in the Atlanta area. And unfortunately, in Atlanta, we don't have a regional cancer coalition. But in the other parts of the state, we do, that are areas where these populations can reach out to these regional cancer coalitions and receive information. Next slide, please. Real quickly, I wanted to mention the NCI Community Cancer Center program. This is a program where everyone knows that 80% of cancer care is actually conducted in community cancer centers, not in the NCI academic institutions. And so St. Joseph Candler in Savannah received funding from NCI to really focus on these, as we call them, pillars. And I wanted to highlight the disparities in outreach. This is a key area that in the Savannah area, as well as Northside recently received an NCI grant. They are really focused on disparities and reaching out to the populations, such as yours, that may need screening, may need education. I'm going to go to the next. Well, that's my last slide. One thing I did want to mention, in Georgia, we have an opportunity for people to purchase with an extra specialty fee the breast cancer license tag, and there are funds that come from that that go into the Indigent Care Fund. And as a result of that, the Georgia Cancer Coalition administers these grants out to nonprofit organizations. And over the years, CPACS has done a wonderful job writing their proposal and managing their grant. And so these are opportunities in our state that we can actually provide additional funding to educate and to help screening for your population. So with that, I have a tendency to go on forever and ever. I'm going to stop, and I'm going to hand this back to Pedro to kind of wrap up our webinar today.
Thank you, Angie, and thank you so much to Marianne as well. As this would be a great time for, we do have a couple questions that people have sent in, so please feel free to send in questions as well. But I just want to briefly just summarize, again, the highlight here, the value of really advocating for disaggregated data among AA and NHPIs. Clearly, it is a very, very diverse group, diverse in language, culture, identity, and it's really important for us to really have a sense on the ground what the community needs are. And before we do that, we really need to get a sense of what that picture looks like. And as Marianne mentioned, it's every 10 years in Georgia, Asian Americans have doubled. So that is profound. That's profound information. That's really important to take away today, that this is a group that we really need to build our understanding about, in particularly in Georgia, because as we've been talking about today, AA NHPIs are an emerging population. And as Angie mentioned, it's really highly important for us to activate and advocate and engage, whether with CPACS or with the GCC, and whether it's participating in the Cancer Patient Navigators of Georgia program or signing up for their newsletter, which I encourage everyone to do. But something that I really want to hone in here that Marianne and Angie have done so well, and something that we honor here at the Health Forum, is the value of relationships and how important it is to cultivate and nurture relationships, especially when we're dealing with disparities among health, such as cancer, whether it's women, men, children, etc. It's really, really important that we continue nurturing relationships, and clearly evident, clearly shown the relationship and the value among CPACS and the GCC. It's a very mutual relationship and very mutually valuable. So we encourage everyone to really seek out Angie and Marianne and sort of discuss lessons learned, best practices, and tap into their local GCCs or other coalitions and organizations. So now I'm going to hand it to Trish to sort of guide us through a brief Q&A.
Thanks, everyone. I would encourage you to ask us any questions using the questions pane, and we do have a few minutes for some questions. We do have questions coming in. So first is, this is for both Marianne and Angie, so feel free to answer these questions. What is the best part of collaborating together from both the CPACS and the GCC perspective, and how did both of you connect with one another?
Well, I'll go first, Marianne, if you don't mind. This is Angie. I think one of the things that has been really phenomenal here in Georgia is several years ago, CPACS had reached out to the Georgia Cancer Coalition and started sending us their annual report. And, you know, as I had mentioned several years ago, they had received one of the first awards for the breast cancer license tag, and I had an opportunity to meet with Marianne and go out to their center and see the fabulous work that they are doing. And so I think the important lesson here is we at the Georgia Cancer Coalition try to reach out to the nonprofits that we know or the cancer organizations, but sometimes we don't always know all of those that are out there. The fact that they had such a great organization and they reached out to us, I think, has created a wonderful opportunity for collaboration. With the breast cancer license tag, they did such a beautiful job of writing their grants. We do a peer review process to award those. So that was based purely on merit and their capability. But then with that grant, I had a chance to work with them and see just what a phenomenal program they put together. And actually, it turns out their office is not too far from where I used to live. So it was real handy for me to go by and meet with Marianne and see their organization.
Marianne?
Yes, Trish, I got disconnected. I'm so sorry. What was the question?
That's okay. The question is, what would be for you the best part of collaborating with the Georgia Cancer Coalition?
I think the best part of the collaboration with the Georgia Cancer Coalition is that we are connected to the larger movement. When I was just listening to Angie, I was so proud to be in Georgia and proud of the work that they were doing. And for us, if the movement is going, if the movement is very progressive in that way, that CPACS to be a part of that movement and to have the Asian American voice in there, that is the best part of being a part of that collaboration.
Thank you, Marianne. Our next question is for Angie. What is the State Cancer Coalition relationship or role with the State Health Department?
We actually, the Department of Public Health, which this past year became their own department, they had been a division within the Department of Community Health, but they actually, we co-chair the Comprehensive Cancer Control Plan effort. They receive the funding from the CDC, but because of what the Georgia Cancer Coalition is able to do to reach out to other nonprofits, it's become a wonderful partnership with public health. Our regional cancer coalitions that I mentioned to you, they also have great working relationships with their public health districts in their backyards. So that has been a very successful partnership for us with public health. But because we are a nonprofit, we've been able to reach out to other organizations that may not have been as easy for public health to. So it's been a wonderful partnership there.
Thanks, Angie. And then our last question, if both of you can just provide maybe a couple of tips. What are some tips that you have for community-based organizations who want to know how to engage with their state cancer coalition? And if there are any suggestions on how to outreach to diverse communities to engage in the coalition's activities. So Angie, can you begin?
Sure. Each state that receives the CDC grant for Comprehensive Cancer Control Plan, they have a plan, and typically they have it published. And so the first thing you may want to do is Google in your state, your Comprehensive Cancer Control Plan of whatever your state is. And that way you will see who you might want to reach out to. We have our plan, current plan, not the one that we're revising at this point, is on our website. So if you were to Google Georgia's Comprehensive Cancer Control Plan, you would be able to access it online. So in the various states, and every state in the nation has received that funding, you should be able to find who's heading up your Comprehensive Cancer Control Plan and then reach out to that person.
And I think from a community-based organization perspective, I think number one is to know the issues. Number two is volunteer to be a part of the plan. And also three, to know what your specific skills are that you can contribute to the larger plan.
Thank you, Angie and Marianne, for answering the questions from our participants. So we are wrapping up our webinar today. Thanks to CPACS and GCC and everyone for joining us today. The webinar has been recorded for your future reference and will be available for viewing at our YouTube page, www.youtube.com/APIHF. And we would also like to encourage you to continue staying connected with us. To learn more about fellow advocates and survivors, please like our Facebook page, facebook.com/APINCSN for the Cancer Survivors Network. And you can also subscribe to our API Cancer listserv and receive information on upcoming events, webinars, funding, and other research opportunities, and also our newsletters on cancer and resources by sending a blank email to apicancersubscribe@yahoogroup.com. And finally, we would really like for you to encourage every one of you to become a member of the Asian and Pacific Islander National Cancer Survivors Network. As I mentioned earlier, we do have around 500 members nationwide, and anyone from an advocate to a survivor through if you have a friend or a relative who is a cancer survivor can join. Please visit our website. It will take you to this page where you can sign up and become a member of the Cancer Survivors Network. And finally, you will also be receiving a short survey from us from SurveyMonkey. I will be emailing this out to you when the webinar ends. Your feedback is very, very important to us in the work that we do, and it will only take a couple minutes, so please do submit your responses. And if you have any questions and want a copy of the slides that were shared today, you can send me an email, and my contact information is on the screen. And again, we look forward to staying connected with you. We hope that you can participate in future webinars from the Health Forum. We are going to be having 3 more of the series of webinars on cancer, and we will send you that information too. So thank you again from the Health Forum and the Cancer Survivors Network. Thanks again, everyone, for your time. And with that said, this webinar is adjourned. Thanks, everyone.
Thank you.
Bye.